According to the Canadian Cancer Society, prostate cancer is the most common cancer among Canadian men, excluding non-melanoma skin cancers. It is the third leading cause of death from cancer in men in Canada. It's estimated that in 2024, there's going to be almost 28,000 Canadian men that's going to be diagnosed with prostate cancer, and this represents 22% of all the new cancer cases in men this year. On average, 76 Canadian men will be diagnosed with prostate cancer every day. Well, I had John Warren on the show back in 2022, and since then, the numbers have actually increased. Just 2 to 3 years ago, there were 10 less men that were diagnosed with prostate cancer each day. Well, prostate health is crucial. And to tell us more about it, I'm very pleased to have John Warren back on the line. John is the president of Prostate Cancer Support Group Montreal and West Island. They're celebrating their 30th anniversary this year. John, welcome back to Life Unrehearsed.
Thanks, Matt. Just a little correction. I'm the vice president, not the president.
All right.
But it's not a big deal.
Trying to give you a little upgrade there, John. But thanks for joining me. Really appreciate it. And congratulations on the 30th anniversary for your group. And John, let's hear about yourself and your own personal experience with prostate cancer.
Okay. It's funny because when I was about 35, I was listening to a guy on the radio, and was it back in Victoria, actually, where I was born. And he said after 50, you should go and get checked out every year by your GP. And that meant, when he talked about that, that meant a blood test, a PSA as it's called, and a digital rectal examination where the doctor puts their finger up your rectum and they can feel your prostate. They're looking or trying to feel a node, which indicates that there could be prostate cancer. So I was diagnosed in 2016. I hummed and hawed about what I was going to do. And eventually in 2019, I decided to have a prostatectomy. That's the removal of the prostate. I don't know if the majority of men decide to do that or not. It's like your mother gives you an apple, but it's got a bad part in it, and so you cut out the bad part. It's that kind of mentality, I think. That's the kind of mentality I had about it. And because I was diagnosed, I wasn't 70 yet. I had choices. After 70, urologist and your urologist that comes on will confirm this. They don't tend to like to do a prostatectomy after that.
Right. And as you mentioned, and yes, we will have a urologist on the second half of this interview, John, to get from a medical perspective, and really appreciate from you, really from the personal human perspective. And as you mentioned, there are different types of treatments, surgery, radiation being the two most popular choices. And so as you said, you went through the surgery route, correct?
Yeah, that's right. Yeah. And it was done laparoscopically. There's 5 little incisions, and it's done with a robot. It's crazy. The doctor that's actually doing the operation is maybe 15 feet from you, and he's got, I think, 4 joysticks or maybe 5 joysticks for every small incision in your body.
Amazing. Listening to Life Unrehearsed, Matt brings some awareness to the public, and John Warren has gone through this process, and you are the vice president of the Prostate Cancer Support Group of Montreal and West Island. We're going to talk a little bit about that amazing organization and the resources available to everyone. Now, we hear more and more, John, about early screening. How important is early screening and regular checkups for prostate cancer, and who should be getting screened?
Okay. Well, generally, the thinking is after 50, you should start to get screened every year. Younger men, it's not a big percentage, but younger men, even in their 40s, can get prostate cancer. So if you have prostate cancer in your family, breast cancer, and I think ovarian cancer, those 3, you have a hereditary factor, so you should get checked out in your 40s, believe it or not. And Afro-Caribbean men have a higher incidence of prostate cancer. If anybody's listening of that group, you should be getting checked out in your 40s. They don't really know why that is. They're trying to figure that out right now. There's research in Canada and the United States trying to pinpoint why that is, that Afro-Caribbean men tend to have a higher rate of prostate cancer.
Well, all the reason...
It's like breast cancer, Matt. The early detection is really important. You don't want to have this go into your soft tissue or your bones, because then you're talking about a whole different scenario that's much more serious.
Yeah, and early detection, PSA tests now becoming very, very popular, and try to get at it early. Very quickly, John, I know you've been through this, and maybe you could share a bit of your experience. How could you still maintain a good quality of life during and after prostate cancer treatment?
It depends a lot on the person, I guess. I mean, I tend to be optimistic. Talking to you right now is my mental therapy. Being engaged, not being isolated, and everybody is, whether you have cancer or not. Isolation is not good for us as a species. We know all kinds of research goes into it. We know that we're social animals. We need to be out and about. One of the things I did, because I had hormone therapy afterwards, I started going to the gym. Hormone therapy affects your testosterone levels, and that means your bones partly, but mostly muscles. So it affects your heart. So very important to go to the gym and work out. I'm not a gym person at all, but I try to get to the gym now 3 days a week.
Well, good for you. Physical health. We're already out of time here, John, but we'd be remiss. You are the Vice President of the Prostate Cancer Support Group, Montreal and West Island, 30th anniversary. How can our listeners find out about some of the wonderful resources offered by this group?
Yep. Well, we're having a peer-to-peer meeting on Thursday, the 26th at 7:30 at the Dorval Community Center on Lakeshore Boulevard. And on the 22nd of October, it's a Tuesday at 7:30, we're having Dr. Ella Kim of the Lakeshore Hospital speak to us, and it's called Ask the Doctor. He will not do a presentation. He will just start taking questions from the audience.
Fantastic.
So he's a urologist at the Lakeshore.
Just great and wonderful knowledge there. I want to thank you very much, John, for spreading the word here.
You're welcome. Thanks, Matt.
All right. That's John Warren, Vice President of the Prostate Cancer Support Group Montreal and West Island. They have a great website. Again, Prostate Cancer Support Group Montreal and West Island. All right. We're going to continue talking about prostate cancer as September is Prostate Cancer Awareness Month. I'm going to be talking to a prominent urologist about symptoms, risk factors, early detection tests, and the latest treatments to combat prostate cancer. And welcome back to Life Unrehearsed. Matt Delvecchio here, and we're talking about men's health and specifically prostate health as September is Prostate Cancer Awareness Month. Very proud to have as our next guest one of Montreal's prominent urologists, Dr. Daniel Liberman. Dr. Liberman, welcome back to Life Unrehearsed.
Matt, it's such a pleasure to be back on this wonderful show. I think it's my third time now, and you do such great stuff, and it's my pleasure to be on.
Well, thank you for taking time. I know you're a busy man, and here you are on a Sunday. We've had you on a couple times, like you mentioned, a couple times talking about bladder health, and today our focus is on prostate cancer. And so let's start, Dr. Liebman, with what are some of the common symptoms of prostate cancer?
It's a good question, Matt. Honestly, prostate cancer at an early stage doesn't really cause any symptoms. But sometimes symptoms of prostate cancer might be related to an enlarged prostate, and therefore sometimes causing people to urinate more frequently, have a slower flow, feeling of an incomplete bladder emptying, maybe getting up at night more often. And again, when prostate cancer becomes more advanced, or what we call stage 4, that's when people can get fatigue, muscle pain, bone pain, and other things that might be associated with what we call metastatic prostate cancer.
Interesting, and all the more reason about early detection, which we're going to talk about in a second. But what do you think, and through the research and your experience, Dr. Liberman, what are some of the major causes of prostate cancer?
Like any other type of cancer, age is a significant factor. So as you grow older, there's more of a risk of you to develop prostate cancer. But at the same time, as you grow older, often prostate cancer becomes more indolent or slow growing. So that's also something to take in mind. Ethnic groups, we know that blacks are more at risk than whites of having prostate cancer and more advanced prostate cancer. People with family history of aunts with hormone-sensitive cancers, uncles, fathers, brothers with prostate cancer and other types of hormone-sensitive cancers is also associated. And we're noticing now that obesity, with having this kind of systemic inflammatory state, is also a risk of prostate cancer.
Listening to Life Unrehearsed, Matt Del Vecchio here, talking to Dr. Daniel Liberman, a prominent urologist here in Montreal, during Prostate Cancer Awareness Month. And, interesting about genetic component as well. All the more reason we keep talking about early detection, which is a key factor. These days, Dr. Liberman, what are some of the ways you test for prostate cancer?
Well, there's a lot of different options that we have now in terms of detecting early localized prostate cancer. But in terms of screening, right, you've spoken about this in the past, but what screening is finding somebody with some sort of cancer before they develop symptoms. That's the whole concept of screening, right? Mm-hmm. So when we're talking about screening, we're trying to find prostate cancer at the stage where we can deal with it and talk about a cure. So early detection or screening means annual rectal exams by your family doctor and annual blood tests that look for PSA, which is what it stands for, prostate-specific antigen. And with prostate cancer, that PSA, that level goes up and might spark other types of things. Now, there's a lot of other modalities, ways that we can actually look for prostate cancer. There's an MRI of the prostate that's now becoming almost standard of care. And then there's biopsies of the prostate that we can also do to detect prostate cancer. But annual rectal exams, annual blood tests, more specifically annual blood tests, are really the way that we screen for it. And then that's often when urologists receive consultations is if a lump is felt on the physical exam or if the PSA rises on 2 consecutive occasions.
And that's where you're getting the call for the next step in examinations and potentially treatment. And, we talked about some statistics earlier on, Dr. Liberman. However, I think in general, it's fair to say that things have improved with prostate cancer and the prevention of it and the treatment of it. A lot of it is due to technology, I would imagine, and it has advanced over the years. So what are some of the more popular treatment methods these days to combat prostate cancer?
So first of all, it's also understanding who to treat and who not to treat, because we did mention it before that there are certain prostate cancers that are indolent, are clinically not significant. Those type of patients you would offer more surveillance or watchful waiting. Patients with localized prostate cancer that is clinically significant, there's options like surgery, removing the prostate, radiation, which is another option, and now there are also localized options to treat localized prostate cancer. And where we have advanced in leaps and bounds is really the treatment of metastatic prostate cancer. Metastatic prostate cancer is when the prostate cancer is not just within the confines of the prostate, but has gone into the bones and into lymph nodes and other organs. And the treatment that we have we have a tremendous amount of options and resources. So often if a patient starts with one line of treatment and fails, meaning the prostate cancer continues to progress, there are many other lines of treatments that are available. And why prostate cancer is so exciting for oncologists and urologists is that we have such a plethora of options and treatments for patients.
Talking with Dr. Daniel Liberman, urologist, who is helping us here during September, which is Prostate Cancer Awareness Month. And we're talking here on Life Unrehearsed. Dr. Liberman, very quickly on the surgery itself. Our previous guest, John Warren, a cancer survivor of prostate, now helping many hundreds of people with a support group. And he says the surgery actually wasn't bad. It wasn't too invasive as we might think it would be. And I think that's even improving year by year.
Absolutely. So there's all these different types of technology. Now the surgery can be removed with a robot-assisted device, a robotic radical prostatectomy that reduces the length of stay and the recovery for patients. Radiation has also improved in leaps and bounds in terms of how they can specifically localize where they're actually treating the prostate with radiation. And now what's now at the forefront of research is not necessarily treating the whole prostate gland, but having some sort of ablative or locally trying to target a specific area of the prostate with different types of energies. If it's cryoablation, if it's heat, or if it's cold, there's many different things out there to treat this.
Very encouraging. And I just want to wrap it up here. We've got about 30 seconds or so. But a lot of concerns I hear from guys, will prostate cancer affect your ability to urinate or have an erection?
It all depends, Matt, on how aggressive the prostate cancer is. So when a surgeon is operating on the prostate, for example, he has to be an oncologist and make sure that he's removing all of the prostate. So if the prostate cancer is a little bit more advanced, then they'd have to resect or remove a little bit over a wider portion of the prostate and the prostate gland. And there are surgery or radiation can affect erections due to the proximity of the prostate to the neurovascular bundles, which are the nerves that innervate the penis for erections. And surgery or radiation can also affect urination and can cause incontinence due to the proximity of the prostate with the urinary sphincter. So it depends on what type of prostate cancer you have, how aggressive the surgeon has to be or the radiation oncologist has to be to make sure that we're talking about a cure. But yes, there are a proportion of patients that deal with incontinence and erectile dysfunction. And more specifically, that is my area of expertise, Matt, is what we call prostate cancer survivorship. There are so many patients who are living past their prostate cancer diagnosis that what's left is their complications related to their treatment. And working at the University of Montreal, University Hospital, working at Elna Urology and Steinberg Urology, this is what I actually do, is I talk to patients and I treat patients suffering from these complications related to the treatment of their localized prostate cancer.
Dr. Liberman, doing wonderful work. I want to thank you so much for coming on. And if people have to reach you, what's the best way to do that?
If there's a consultation, I can be seeing patients at Elna Urology. I can also see patients at Steinberg Urology without a medical consultation.
Wonderful. Thank you very much, Dr. Liberman.
Matt, it's a pleasure, and thank you again for having me.
Most welcome. That's urologist Dr. Dan Liberman. All right, next up on Life Unrehearsed, any golf fans out there? We're going to get the inside scoop on the upcoming President's Cup tournament that will be held right here in Montreal in a little more than a week. That's coming up after a CTV News update.